Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Surg RN chapter NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started.
The NCLEX is broken into 15 domains areas. It is not just about knowing your content, it's about knowing how to apply in different situations. I always say they have a psychology of it. So those domains include the traditional 8 categories. Let me get my light. The 8 categories here, like management of care of psychological adaptation, plus the 6 steps of clinical judgment, right here. So this is somebody's CPR, they call it the candidate performance report. And you need to have a green light for all of these in order to pass. And I have the booklet from the NCLEX. I mean, you can go online and download it, or you can just go down below and just download it. And in order to pass, you need to complete this PI plus here. So by organizing your notes around those 15 domains, we can learn how it plays them into the correct context for exam. So each chapter we focus one question, NCLEX style, to help us to identify like the CPR, this CPR, this CPR. Okay, let's go next. My light, I'm sorry for my light. You can see these are the topics. Like for instance, if you get a question from this chapter, these are the categories from the chapter, like patient identification and timeout gonna be also in your quizzes. Sterile field and asepsis, this definitely will be everywhere, and also on your clinical side always, because you're gonna do practice in Surg or other places, other departments, and you need to know about this. I think chapter 15, 16, 17 is like not just in NCLEX. I think it's mostly like to know when you are do your clinical rotation in hospital. Anesthesia management, right? Positioning the patient. In outline, it's a lot about this. The book has pictures, so you go back and you look. In the key terms, also I specify some of the positioning and devices, and patient may get the pressure, injuries because they have a long surgery, etc. So go back and review that in certain positions there for certain surgeries. So keep in mind that. You can take a short screen. I'm going to stay a little bit longer, so you can take a short screen, have it ready. But if you wanted like better in the paper, just give me a comment and then I can send it to you. I have it already and you can highlight it. Then intraoperative safety measure. Then we have medication administration, monitoring and documentation, intraoperative emergencies, cardiac arrest, and but also the allergies you can see there, the thermoregulation, blood and fluid management. Here always they will every surgery will have, like, during the documentation, medication list that they do during the surgery, but also or procedure, or they have to say the blood loss. So because the baseline was prior, and then if the blood it's lost a lot during the surgery, or even if it's minimal, the labs, the CBC will show different. And this you'll see when you are in med surg clinical rotation, because you're gonna see the labs. Then you have communication and hands out. It's very important. The communication is always, it's a lot of issues with communication, even when it's overwhelmed, hectic day, it's always something missing. So starting first with a habit of being detailed in communication during the very hectic day, then will be handy, that experience, because you do over and over and over, is like a brain muscle for you. The next is psychosocial support, anxiety. Also, we talked in chapter 15 about anxiety, and then in intra, and then also post is very important. This issue is very, very important. So now we're going to go next. Probably this you like the most. This is the CPR, the candidate performance report. And here is the NCLEX domains where you have the pie to complete, and then the rest. So you see there are 15, and you can take a short screen, or if you want it, I can give it to you all in one, so you don't have to worry. I will just give you a link into the Google Drive, so you can download anytime. So here, let's go basic care. I saw in this NCLEX, it's a Facebook. I mean, there are a lot of study groups, Facebook, and they talk about those CPRs and how they fell. And I saw a couple of them, and like 90% of the candidates that had fallen on this exam, one of them was basic care. So I'm going to start with basic care and comfort, ensure proper positioning, padding. So the devices, I talked about those in keywords in the terminology, and they have also in a textbook picture there. Neglecting obese, elderly positioning needs, pressure, nerve injury. This in intraoperative, in preoperative, you need to take the height and weight. I said there about is very important to arrange the table. And yeah, the pressure pads, warming blankets, positioning straps. About the meds, it's always all about Oh yeah, you need 2 RN blood verification. I think every RN knows that they always there 2 RNs for blood verification. So if a patient have like a surgery and it's a risk of bleeding a lot, and the surgeon will say you're gonna lose a lot of blood, I think some patients they get transfusion from their own blood and they can give it when they lose it, they give it back, or not, or just get the blood bank. But I think it's very good when a patient agree to get a transfusion and keep the blood, and then later after the surgery or during the surgery, if it's a lot of blood loss, they can get their own blood right away. But also you still have the 2 RNs. And then let's see, clinical judgment, make safe, timely decision under pressure. The more detail you think about and you do, then the experience will help you, and you're gonna have a like a brain muscle. And take action. We implement correct intervention very fast, right? This is very important. I think not just for the NCLEX, just as an RN, even as a student, when you are part of the team, you need to act fast. You need to know the action. This chapter and 15, 16, 17, I think it's very, very important as a student nurse. So much for talking on this. Let's move on. Oh, my light. Sorry. If you see here in the case study, I say female. Sometimes it's necessary to know female or male because of risk factor. Some risk factors, some diseases has a lot of the female, but I think in NCLEX it says adult. Probably rarely say adult female or older adult. Always they call adult. But let's say 72-year-old female with a history of type 2 diabetics and hypertension is scheduled for an elective. You see, it's a keyword, elective. Laparoscopic cholecystectomy in an outpatient surgical center. So that is like in and out, right? She arrives at the preoperative holding area on time, accompanied by her daughter or son or someone, friend. During the preoperative assessment, the nurse notes that the patient wears a hearing aid, has mild scoliosis, and expresses anxiety about general anesthesia due to a past negative experience. But here I have question, like, this person come in, but it's not like an walk-in, has an appointment already, so talk to the doctor already, and I think had a pre-talk about the negative experience and general anesthesia. So why have it now? But might happen. She has been NPO since midnight, and her vital signs are stable. Stable, and many people, in many places, it says what means stable, like what means within normal ranges. I should correct that, within normal ranges. Her surgical consent and advance directive were signed and verified the previous day. So she was previous day, so why still having those thoughts? In the operating room, the circulating nurse ensures that the surgical pause is completed and that all sterile and non-sterile team members are accounted for. Patient is positioning in the supine position with the slight tilt to accommodate her spinal curvature. Okay, so it has also spinal curvature. Oh my goodness, this text is like unreal. The anesthesia provider administered general anesthesia without complication, but 20 minutes into surgery, her the CO2 rises and muscle rigidity is observed. The team suspects malignant hyperthermia MH. It's a keyword. I explained that in the keyword video, the terminology I call it. I talked about that. Immediate intervention are initiated, including administration of dantrolone, cooling measure, and discontinuation of triggering agents. Patient is stabilized and transferred to PACU for close monitoring. This is like, you try to make a story with so many wrong things. So we move to the questions now. It's second time when I record, make me laugh those questions. Question 1, category, it's a safety. What is the priority nursing intervention when malignant hypothermia is suspected during surgery? So it's a keyword, so we need to know. Increase the patient IV fluid rate to flush the system. Administer IV detroline immediately. Prepare for emergency tracheostomy. Administer a sedative and delay surgery. So what is the correct answer? I think you are even faster. Talk so slow. Administer the IV detroline immediately. I think they talked that in the case study. I. Question 2, category legal, ethical, informed consent is very important, always and forever. Which preoperative finding requires the most immediate follow-up by the nurse? Mild scoliosis, history of anxiety with anesthesia, use of hearing aid, signed consent not witnessed. Correct question. Correct answer is signed consent no witnessed. So that's because that is a question. Legal, ethical requires the most immediate. So you don't do anything before you don't have consent witnessed. You don't touch a patient without consent. Question 3. This is the roles and responsibilities. Based on the patient history and intraoperative event, which team member plays the central role in diagnostic and managing MH? The perioperative RN, scrub tech, anesthesia provider, or surgical assistant? So it's the anesthesia provider. The next, Positioning and safety, right? Safety again in with positioning. Which position is the most appropriate for the patient's surgical procedure considering mild scoliosis? So that could be spine prone, supine with support for spinal curvature, lithotomy with padding, or the Trendelenburg without tilt. So those one I talked in the terminology. There it's all explained which and which. But for here we have supine with support for spinal curvature. So you have those devices, same in the keyword terminology video for the chapter. Safety, surgical pause verification, very important. What is the primary goal of the surgical pause timeout? To allow the patient time to relax before surgery. I like those questions. To ensure all surgical instruments are accounted for, to confirm patient identity, surgical site and procedure, or to initiate anesthesia protocols. I think it's very obvious. To confirm patient identity, surgical site, and procedure. Yeah, I like time to relax before surgery. Oh, I like that. So question 7, category lab values. The nurse is reviewing a patient labs before surgery, right? This is in previous chapter, preoperative, but it's previous chapter was talking about during the surgery, and then in this chapter they talk about pre and post. So it's kind of those three chapters that are also related. They just divided in three, I guess, because it's so much information, is so big. Which results should be reported to the surgeon immediately? So hemoglobin, potassium, white blood cells, blood glucose. I think it's obvious. But if it's not obvious, it's fine. You can look for my flashcards from the shorts and I upload it. I have from ATI the labs values and the explanation from them. So it's not from me, it's from a source from ATI. Okay, so the correct answer is potassium. And then why? Potassium more higher than 5.5 can cause arrhythmias under anesthesia. So the trap tip, even if other values are borderline, the potassium always wins in prioritization questions. Yeah, always potassium because it's the heart, and without then if the heart shut down, then it's problematic. Here it's like when we talked about terminology that will be in quizzes or final. The role of circulating nurse during surgery include managing sterile fields and ensuring the patient safety throughout this procedure. So you see terminology. So if you don't know the terminology, you can answer. So it's the advocacy. So it's a key role and often overlooked. It's about ensuring the patient's rights, safety, and proper procedure rights, patient rights. So they have the right. The next one, the most common type of anesthesia used for minor surgical procedure, allowing the patient to be alert but relaxed. Yes. So it's alert and relaxed. So it's the local anesthesia. So you need to know the types of anesthesia. Local allows the patient to remain conscious, while other, like general, induce unconsciousness. So local, it's just one area. Okay. What is the nurse's role in maintaining a sterile field during the surgery? What is her role? Okay. What is the nurse role in here? The nurse ensures that all equipment is sterile, handles instruments properly, and verify that no contamination occurred during the procedure. So look for action-oriented responses. Nurses must prevent contamination, not just observe. And the next, why is it important for the anesthesia provider to be aware of the patient's history for allergies? Why? Allergies to anesthesia agents or medication can lead to life-threatening reaction, making it crucial to adjust the anesthetic plan accordingly. So the tip is focus on the patient's safety and risk. So previous chapter, this chapter talks about a lot of allergies, and always when you see a patient, always you ask about the allergies. What is your allergies? Food, medication, environment.
Thank you so much for being here with me today. I hope this video helped make things feel a little bit clearer and a little bit less overwhelming. If it supported your learning, please give it a like or share it with a fellow student who might need this too. Everything we cover connects back to real nursing, whatever it's recognizing a critical lab, planning safe care, or knowing what to teach a patient. Let me know down in the comments below. What was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped and made it easy for you. You can also let me know if you like the notes for this chapter. Check the description. I usually add some few free resources there just for you. Thank you again for your time and your trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye from now.